pork healthy? Our lawmakers must think so, because the health care bill on the Hill sure is, well, full of it, shall we say. Billions of tax dollars are reportedly ready to go for, get this, jungle gyms, farmers markets, street lights, and walking paths. They say it'll all promote healthier living and drive down health care costs. But someone here says they're full of it. Hi, everyone. I'm Brenda Butner. This is Bulls and Bears. Let's get right down to it. The Bulls and Bears this week: Gary B. Smith, Tobin Smith, Pat Dorsey, Eric Bolling, along with Democratic strategist Sarah Flowers. Welcome to everybody. Okay, Eric, bottom line, is pork in the healthcare bill good or bad medicine for the economy?
It's bad. It's going to make us sicker. Honestly, I'm sick and tired of government telling me how I'm going to work, how I'm going to play, and now how I'm going to exercise. The bottom line, the healthcare bill was supposed to address the availability of health care and the cost of health care. It really wasn't supposed to go and tell me when I'm going to work out and whether or not I should go buy, you know, a squash that Tobin...
Don't touch Tobin's squash.
We're not going there.
No, okay. Farmers market.
Sarah, now the argument from supporters say this does exactly get to the point of the cost of health care, because it's prevention.
This absolutely does. This is prevention. What we're calling pork here, because it's a nice buzzword, really is prevention. It's the tactics of how you make a healthier community, and in the end, how you save dollars. We're talking about creating jungle gyms so that kids can go outside and play in communities where that doesn't exist. A Harris poll of 1,600 parents of 2-year-olds to 12-year-olds said that 41% of them said that the reason their kid didn't get enough outdoor time was because they didn't have a local community park to go to. It's not about when people like us should go to the gym. It's about actual families in middle America and the resources that they have to live healthy lifestyles.
Well, the problem here is that where's the carrot? Where's the stick, Toby?
Well, the problem is, with all due respect to our strategist friend, that she's completely missed the whole economic point. In the United States, 20% of the population consumes 80% of the health care bill. That is an absolute fact. It's not little kids playing on a jungle gym. And the problem with this whole idea of prevention investing, by the way, it's always an investment, it's not an expense, is that if you don't have a carrot and stick, if there's not a financial incentive and disincentive to use this, the irony of the whole thing, the healthiest people are the ones who are going to use these preventive things, and it doesn't help them at all because they're already healthy. Right. It's absolutely the wrong way.
Here's the financial impact. Kids who exercise
We're not talking about kids. Kids don't consume health care. 20% of the people in America consume the health care.
It says that $137 million is wasted every year because of obesity-related illnesses. Kids
it's $137 billion easily.
With asthma attacks that could be prevented if they lived healthier lifestyles. Hold on. I want a small part of a big bill.
I want to let Pat get in here because he has an interesting perspective. Pat?
Well, we are the fattest nation in the world, and that's a fact. You know, 33% of Americans are clinically obese, and obese people do consume more health care in terms of diabetes, in terms of heart-related costs. And you're right, Toby, those kids aren't consuming health care, but if they become obese and grow up, then they do consume a lot of health care. You know, will people just go out and use these jungle gyms and walking paths without a financial incentive? That's a debatable point. But an ounce of prevention is worth a pound of cure, and if you couple this with something such as this, you know, where smokers pay more on their health insurance than non-smokers do, and so you have obese people paying it. But the point is, if you don't do that, if you do that, and they don't have the resources available to exercise, you need both parts of it. And so this is at least a step in the right direction.
I don't know. Is it, Gary? What do you think? Are you going to get any kind of return on your investment here?
Well, yeah. I mean, the return on the investment is the congressman or senator, whoever got that park built and had that, those people hired to put it in, they're going to be happier and they're going to get reelected. That's what this is all about. This is not, the people sitting in Congress really they don't really care about the health of the American population. I mean, that's ridiculous. Look, when people were growing up in the 20s, 30s, 40s, 50s, there wasn't all these fancy jungle gyms and stuff. What my parents did was get out of the house and don't come back for 8 hours and go play.
Well, that explains it.
Brenda, I'm sure that's what you did too. I mean,
well, just because you were born in the 20s, Gary, I don't see how that applies.
Well, it's not. Well, then you know what? It's the parents' responsibility to make sure the kids are healthy. It's not, getting back to Eric's point, the government's responsibility to coerce and push people into a healthy lifestyle. Look, the American people want to be obese.
How is building a jungle gym coercing someone?
Well, how is building a jungle gym
or putting in a path coercing someone, Gary?
Well, you're using resources from the people, diverting into what the government thinks is good. Let the people
Putting it
keep
back
their
into the people's
finances and
community.
spend it on what they want.
Sarah.
That's not coercion, Gary.
All right, fine.
well, what is it then?
That's a word point. You lose a word point, Gary. But
Okay, but is this, Eric, an example of that the health care bill is kind of out of control? As with almost anything Congress does,
Brenda,
the stuff gets...
Brenda, Rangel said today that this week that they're going to start taxing. They're going to add a surcharge. Anyone makes over $500,000 a year, then $750,000 a year, $1 million. They are just doing everything they can to make this thing bigger and bigger and bigger, and they still can't provide health care for everybody. And why in the world is a jungle gym going to help an obese adult?
But, you know, the thing is, we're always treating the symptom and not the problem. And, you know, the actual problem we've talked about, you know, for months and months is, A, you have people who have these health plans that they don't tax, so therefore they go spend money like they don't have it because they don't care. And, B, you have physicians and doctors who get paid on a per, treatment, and they get more money to treat. Those are the two problems. This does nothing to deal with those problems.
What they should do is use all that money and reduce costs of drugs. Subsidize the cost of drugs and building drugs.
If we don't have a healthy society, then charge less healthy people more money, and guess what? Maybe they'll be incentivized.
I mean, Sarah, what they're basically saying is this doesn't get to the point. It's not helping to pay for, it's not really prevention, because you're just putting, if you build a jungle gym, people aren't necessarily going to come.
No, this is the definition of the tactics that go as to part of prevention. It's giving people tools to live a healthier lifestyle. It's creating communities that promote health, which in turn create healthier people who consume less health care. It's a long-term strategy, and it's one small part of, as you mentioned, a very big bill.
It's like
prevention.
It's like treating alcoholism with a juice bar down the corner. It's not going to work.
Yeah.
It's not going to help.
Prevention over the last 50 years has been the gigantic sinkhole, because unless you have a stick to have people do it, those unhealthy people won't do it, and the healthy people get healthier, which is hilarious.
The point of the jungle gym is to train a new generation of healthy people.
Well,
the people who are 60 and obese right now, that is a different
minus
challenge.
$1.6 trillion now
to train these people.
Okay.
Why did the government have to intercede to solve this problem?
The government's putting money back into communities, and that's where that money should go, into creating better, healthy communities.
Well, the government shouldn't take the money out of the communities and decide where it goes to begin with. Let the people decide.
Why don't they start showing movies in my community, too? I don't have enough movie theaters. Can we get that? Because I'll walk to that movie theater.
All right. That's good. Pat, you know what? You ought to drop a few pounds.
Yeah, I bet.
On those jungle gyms. All right.